Today, I'd like to take you on a journey looking at the potential health benefits of the sun. And I was really heartened to see so many hands go up, indicating that you had actually been out in the sun this morning. Because sunshine is actually really very good for our health. And what might surprise a lot of you is that it's not all about vitamin D. In fact, when we have a look at the data, probably very little of the benefit is about vitamin D. And in the process of this exploration, we're going to uncover some surprising facts. Not the least of which is that even having a skin cancer is often associated with no decrease in our mortality. So we're then going to explore different ways that we can expose ourselves to the sun to make it safer. As with all my lectures, this should not be considered personal medical advice. This is my personal interpretation of the science, and if you want personal advice, then please consult your physician. Now, I want to start by talking about sunshine. There's something special about sunshine that makes us live longer, even after accounting for skin cancer. Sunshine reduces the rate of death from a number of conditions, and it's probably not an effect of vitamin D. This is a graph from the World Health Organization, and it shows death rates between the two hemispheres. And what you'll see here in the red line, the southern hemisphere, which is where we are, is that the mortality rate peaks in July, our winter. And we can see the reverse in the northern hemisphere. And predictably, the equatorial countries shown in grey have much less variation. And this trend still persists, even when we statistically control for things like influenza. Now, this is not conclusive evidence of a benefit of sunshine, but it certainly does give food for thought. Let's take a look at a Swedish study that had over 38,000 females, and it followed them for 15 years, and it assessed sun exposure and their chance of dying, or mortality. And this was from the results table of that study, and it compared those with a history of sunbathing vacations, and yes, in Europe that is a thing, compared with those who had never been on a sunbathing vacation. And what they found was that there was a statistically significant trend for lower mortality in those who had been on sunbathing vacations. And perhaps even more surprisingly was they had a similar finding with a history of sunburn. Those people without a history of sunburn had a higher death rate than some of those with a history of sunburn. So in a similar vein, let's have a look at another study, but rather than looking at sun exposure, let's look at sun avoidance. This was also a Swedish study, and it looked at almost 30,000 females over 20 years. And it compared sun exposure behaviours to mortality. And the different shades of grey you can see here in the graph represent different causes of mortality. And this first graph shows the mortality over a 20-year period in those with the most active avoidance of the sun. This second graph shows the mortality rate in those with moderate sun exposure. And as you can see, the rate of mortality is clearly less than in the first group. And finally, this is the group with the most active sun exposure. And you can see even further a larger reduction in mortality. Now, to appreciate how large this effect was, smokers who had the highest level of sun exposure had an equivalent level of mortality as non-smokers who had the lowest. This suggests that the magnitude of effect of avoiding the sun could actually be comparable to smoking, which is really quite astonishing. Now again, this doesn't prove causation, but it certainly gets us thinking. So let's now address the big elephant in the room when it comes to sun exposure, and that's skin cancer. We need to balance the harms and risks of the sun, and UV radiation has been clearly associated with skin cancer in a dose-dependent fashion. That is, the more sun exposure we have, the more likely we are to have skin cancer. But on the other side of the coin, UV radiation is associated with a reduced risk of about 14 other different types of cancers, as well as reducing the risk of heart disease and diabetes. So let's have a look at a study that looked in particular at skin cancer and mortality. And this study was based on the entire Danish population over the age of 40 years, all 4.4 million of them. So this graph here compares the mortality rate in those with a diagnosis of melanoma skin cancer compared to those without a history of any skin cancer. So the light grey line here shows those with melanomas, and the darker line here shows people without any skin cancer. And you'll notice that there's very little variation between the two groups. Having a melanoma in this population didn't seem to significantly impact on lifespan. What about non-melanoma skin cancer, squamous cell carcinoma and basal cell carcinoma? Well, you can see here in the light grey line that those with non-melanoma skin cancers, on average, lived longer than those without any skin cancer. Repeat, those with non-melanoma skin cancer lived longer than those without, and by some margin too. Comparing the age of death along the bottom scale there, you can see there's almost 10 years difference between the two groups. Now, not every study has replicated this finding. It's population data, and the experience of an individual could be different. But it does indirectly indicate that even in the presence of skin cancer, sun exposure might be beneficial. And to understand why sun exposure could be so helpful, we need to understand a little bit more about ultraviolet radiation. Ultraviolet radiation has a smaller wavelength than visible light, and we divide it into three categories: UVA, UVB, and UVC, which you can see on the left-hand side. UVA, which you can see in yellow, easily penetrates the atmosphere, and most of it reaches the ground. In contrast, a lot of the ultraviolet B radiation is attenuated by the ozone layer before it reaches the ground. And this point is really important because it means that the thicker the layer of atmosphere that it passes through, the less of it that will end up striking the ground. And that means that at different times of day, our relative exposure to UVB can be significantly different. And having a look at UVC, we can see that none of it strikes the ground at all, so we don't have to worry about that from here. So when the sun's directly overhead, it's passing through the shortest amount of atmosphere before it reaches us. So we're getting relatively proportional amounts of UVA and UVB exposure. But when the sun is lower in the sky, as in earlier in the day and later in the day, the UV radiation passes through a much greater mass of atmosphere, and especially the ozone layer. And this mostly affects UVB levels. So you can see here in this graphic that when the sun's coming up in the morning, the amount of ultraviolet B radiation is actually far less, but the amount of UVA radiation is relatively preserved. So let's take a closer look at UVB radiation. This is the main cause of sunburn, and it's the principal cause of skin cancer. Both accumulated UVB exposure and intermittent intense exposure have been shown to contribute to different types of skin cancer. On the other side of the coin though, UVB is what leads to the production of vitamin D in our skin from cholesterol. And it's this vitamin D that many people attribute the health effects of the sun to. But as we're about to learn, while vitamin D is really important for our bone health, it doesn't significantly impact our lifespan in a way that we've seen from the previous studies. UVA, in contrast, is far less implicated in skin cancer. To a degree, it can cause a slight increase in risk, but much less than with UVB. It does play a role in skin ageing, especially with pigmentation changes, and it might also contribute to wrinkles. But this is one of the most important things that I'm going to say today. UVA radiation releases a substance called nitric oxide in the skin. And this is a substance which actually helps you live longer. I'll repeat. UVA radiation releases a substance called nitric oxide into the skin. And it's this nitric oxide which explains the link between reduced mortality and sun exposure. These pictures here show how nitric oxide is increased by increasing exposure to UVA radiation. Now, when we get exposed to the sun, we get both UVA and UVB radiation. So we produce vitamin D and we release nitric oxide at the same time. So it's quite logical that our vitamin D levels, to a degree, would reflect all-cause mortality, if indeed that's where we're getting the benefit. But just remember, the benefit comes from nitric oxide, not vitamin D. The vitamin D is just a surrogate marker. That's not to say vitamin D is not important, because it is. So this here is an X-ray of a 6-year-old boy with a condition called rickets. And this is a problem that's caused by vitamin D deficiency. It results in deficient mineralisation of the bone. And that's why these bones have bent, because they're soft. They can't support his weight without bending. Now, it used to be thought that rickets was a condition of a bygone era, something that we shouldn't really see in modern medical practice. I've diagnosed 2 cases in just the last 3 months. So vitamin D deficiency is still a very relevant public health issue in Australia today. The problem is vitamin D just doesn't explain the increase in lifespan. It is incredibly important for bone health, but it doesn't give us the huge mortality benefits that we saw from the other epidemiological studies. So where does vitamin D come from? Well, we can get about 5 to 10% of our daily requirements from food. Now, very few foods naturally contain vitamin D. Fatty fish, liver, and eggs. But what's that, you say? Why is margarine here? Well, in Australia, table margarine is mandated to be fortified with vitamin D. And perhaps concerningly, it ends up being one of the major sources of dietary vitamin D in the Australian population. It's clear, though, that most people don't get enough vitamin D from the diet, so another source is needed. And as you now know, that source is the sunshine. UVB rays strike the skin and convert cholesterol in the skin to vitamin D. And it's also, when the sun strikes the skin, we get a little bit of UVA exposure, and that produces nitric oxide. But as we said, vitamin D could be predicted to be associated with all-cause mortality because it's also associated with nitric oxide release. And this is indeed what we see. This graph here is from a meta-analysis which pulled the results of 32 individual studies, comparing the risk of dying between individuals with varying levels of vitamin D. On the left, you can see the risk of dying, and along the bottom, you can see the vitamin D levels. And what you can see is that in those with a low vitamin D, the risk of dying is almost double that of people with high levels of vitamin D. And this is from a cohort study of almost 10,000 German men between the ages of 50 and 74, and it followed them for 9.5 years. And they compared their death rates into different groups based on whether they had low vitamin D levels, less than 30 nanomoles a litre, or higher vitamin D levels, more than 50 nanomoles a litre. And the decrease in height of the line represents increasing mortality. In other words, the more the line drops, the more people died. And what you can clearly see here is that those with lower levels of vitamin D had a much higher rate of death than those people with a higher level. So then what does this mean? When I test the vitamin D of one of my patients and it comes back low, as in this lady, what do? Is it worth me supplementing her with vitamin D? This was a 44-year-old office worker, and she didn't see much sun. And when she did, she was always very careful. She always covered up, wore a hat, wore sunscreen. She made sure that she looked after her skin. So in this case, should I give her a vitamin D supplement? Let's see what the evidence shows. Now, remember the big difference in lifespan that you saw with very high and very low levels of vitamin D? Well, let's see what happens when we give vitamin D as a supplement. This was a study of more than 2,600 subjects, and they were randomised to receive either 800 international units of vitamin D a day or a placebo, and then they were followed for 5 years. And the 2 lines here measure the death rate. The higher the line, the higher the death rate. And you can see there's virtually no difference between the supplemented group, represented by the solid line, and the placebo group, represented by the dashed line. And this finding has been replicated many times. These are 2 systematic reviews, both of which found no significant benefit from vitamin D supplementation with respect to mortality. The top one reviewed 13 observational studies and 18 experimental trials and found no significant benefit. The lower one looked at 290 prospective cohort studies and 172 randomised trials, and also found a big discrepancy between the benefits seen in observational studies and the benefits seen in interventional studies. That is, those studies in which people were given vitamin D tablets. So this leads us to conclude that vitamin D is probably not the answer. So let's take a closer look at nitric oxide, the substance that's released in the skin in response to UVA exposure. This is a study in which participants were exposed to either real or sham ultraviolet radiation of the UVA type, and the effect on blood pressure was monitored. And you can see here that the real UVA exposure in the lower line led to a much more significant drop in blood pressure than the sham UVA. And this effect occurs because nitric oxide, which is released from UVA exposure to the skin, actually relaxes our blood vessels. And this also impacts our blood pressure outside of the laboratory. Remember the graph from the World Health Organization showing that mortality rate is actually lower in summer? Well, this also happens with blood pressure, where we see lower blood pressure in summer than in winter. And it's got a very tight correlation with UVA exposure. And this is really important because high blood pressure or hypertension is a major risk factor for heart attack, for stroke, and a host of other vascular diseases, which is why we see this peak in heart attacks in the winter. Now, nitric oxide also benefits our blood glucose level by improving the sensitivity of insulin. And high blood sugar is known as a risk factor in many diseases, heart attacks, stroke, dementia. And here we can see that the addition of sodium nitroprusside, which breaks down to nitric oxide, allows insulin to remove sugar more effectively from the circulation. So then, we might predict that blood sugar control would be better in summer than winter. And that's exactly what we see. This is a measurement of average blood sugar using a test called HbA1c. And that measures how much glucose is in the circulation over a period of about 4 to 6 weeks. And this graph from a Northern Hemisphere studies shows that HbA1c is significantly lower in the summer. And understand that HbA1c is one of the most powerful markers of disease that we have. A reduction in HbA1c is very significant. So if indeed nitric oxide lowers our blood pressure and improves our blood sugar control, the question is, how do we get more of it from sun exposure while minimising our risk of skin cancer? Now remember, when the sun's lower in the sky, we're receiving proportionally more UVA than UVB, and it's that UVA that produces more nitric oxide. Well, it then makes sense to expose ourselves to the sun more when the sun is lower in the sky. And this graph demonstrates that ratio is much better earlier and later in the day than when the sun's overhead at solar noon. Now, to put the flip side onto this, if we get an optimal exposure of UVA at the extremes of the day, then right in the middle of the day we probably have a suboptimal exposure to UVB. And that's shown by this, which is called the UV index. Now, the UV index is basically something that reflects the tendency of the sun to cause sunburn. And because of that, because it's UVB, especially shortwave UVB that causes sunburn, the UV index is heavily weighted to shortwave UV, the UVB variety. Now, it's a linear scale, so that means that a UV index of 10 will burn you twice as quickly as a UV index of 5, and so on. Generally, if the index is 2 or under, there's no risk of sunburn in most individuals. And if UV index is 3 or 4, then most individuals could spend an hour in the sun without protection, without significant risk of sunburn. It goes without saying, though, that your personal skin type does come into that, so you do need to be cautious, and some people taking certain medications will sensitise them to the sun exposure. So that shouldn't be taken as a concrete rule. Now, what happens if you're outside and you don't know what the UV index is? Well, you can use the length of your shadow as a pretty good surrogate marker. Remember that when the sun's low in the sky, you're getting proportionally more UVA and less UVB, and that's when a longer shadow is being cast. Now, there's various interpretations of what shadow length you should be concerned about, but generally speaking, if your shadow is as tall as you are, you should be able to spend at least half an hour in the sun without any protection. Now, many people conflate temperature with UV exposure. Now, what do I mean by that? You're outside and it feels hot, so you assume you're getting more UV radiation. So I'd like you to look for a moment at the black line here, which represents the UV radiation. And you can see that it peaks at about 1 o'clock. Now I want you to have a look at the red line, representing temperature. And you can see that that's peaking at about 6:30. But at the time the temperature peaks, it's actually associated with quite a low level of radiation. So don't rely on temperature. Using your shadow will be a much better guide. So now I'd like to move on to have a look at other means of reducing skin cancer risk, primarily supplements and medications. The risk of skin cancer is much higher in people with diabetes. There is a silver lining though. One of the drugs most commonly used to treat diabetes, metformin, might actually reduce the risk of skin cancer. So this was from a study published earlier this year. And it compares the rate of skin cancer against total lifetime dose of metformin. And it found that those who had a higher total lifetime dose had a much lower risk of skin cancer. And you can see that the group who never used metformin had more than 4 times the risk of skin cancer than the group who used it the most. So good news for some diabetics. Let's have a look at something called nicotinamide, or vitamin B3. This was an excellent study done here in Sydney, actually, and 386 participants with a history of non-melanoma skin cancer were randomly allocated to either receive a placebo or this vitamin B3, 500 milligrams twice a day for 12 months. And what they found was that there was a significant reduction in skin cancers, mainly due to a reduction in squamous cell carcinomas. And this indicated that if you had a history of non-melanoma skin cancer, it would probably be worthwhile supplementing with this. I want to now move on to one of my favourite topics, omega-3, found in fish oil. In this study, 15 volunteers took high doses of fish oil for up to 6 months, and their tendency for sunburn was assessed. Now, how do you assess that? Well, we do it by exposing them to varying amounts of ultraviolet B radiation and then reviewing them 24 hours later to see the skin response. And the smallest amount of UV radiation that it takes to cause a detectable reddening of the skin, basically a sunburn, is recorded. The technical term for this is minimal erythemal dose. And this process was done before and after supplementing with fish oil for 6 months. And the effect was significant. On the left side here, you can see the dose of radiation causing sunburn before the supplementation. And as you go down to the right, you can see that the dose of radiation required to cause this burn damage to the skin significantly increased. So it more than doubled after 6 months. So effectively, that meant that you could spend twice as long in the sun without getting burnt. The benefit wore off pretty quickly after stopping the fish oil though, so it seems that a continuous dose of fish oil is probably necessary. And there's another benefit of omega-3 fat supplementation which is very relevant to skin cancer, and that's got to do with the immune system. The immune system doesn't just attack pathogens like bacteria and viruses. It can also play a role in identifying and neutralising abnormal cancer cells. So anything that leads to impairment of the immune system potentially increases the risk of cancer. And it's well known that people on immune suppression therapy, like those people who have had organ transplants, have a much higher rate of skin cancer. And we know that UV radiation impairs the immune system. And many people experience this after they've been out in the sun on a weekend and they get an outbreak of cold sores. And studies have shown that if we expose mice to chronic doses of ultraviolet radiation, they're not able to reject transplanted tumours like healthy mice. So the immune suppressant effect of UV on the skin is really significant when it comes to skin cancer. And in this study, they explored the immune suppressing effect in people taking fish oil and those without. It was a study of 79 females. And what they found was a significant reduction in the immune suppressing effect in those who took fish oil for 3 months. And this is a combined meta-analysis and systematic review that compiled the data from 11 observational, interventional and mechanistic studies on the risk of skin cancer and omega-3 supplementation. And it found that the consumption of high levels of omega-3 fats was associated with a 48% risk reduction in melanoma. And this fits very well with the data we've seen on sunburn and immune suppression. So this then leads to the logical question. How do we optimise the level of omega-3 fats in our cells? And it's at this point of the story I'd like to introduce a villain. This is vegetable oil, except it doesn't come from vegetables. It comes from seeds. And before it found its way into our food supply, it used to be used as a machine lubricant. But that's not the problem. The problem is vegetable oils are very rich in omega-6 oils. Omega-6 oils are shown here in yellow, and you can see that vegetable oils, by and large, have very large quantities of them, and correspondingly, very small volumes of omega-3s, shown in orange. And the problem is that omega-6 fats are quite harmful in skin cancer. They increase the production of, among other things, something called the series 2 prostaglandins, and these increase the inflammation and carcinogenic expression within the skin in response to ultraviolet exposure. Omega-3 fats, on the other hand, they lead to the production of series 3 prostaglandins, which inhibit these processes. And if we increase our omega-6 level, well, this leads to a reduction in our omega-3 level. So remember that margarine? Well, it might have been fortified with vitamin D, but it was loaded with omega-6, reducing your ability to spend time in the sun. So maybe it wasn't such a good deal after all. Let's take a look now at how we can use the relationship between omega-3 and omega-6 to our advantage. This was from a dietary intervention study. No supplements were used, just changes in diet. And in this part of the study, participants were placed on a low omega-6 diet, the kind without vegetable and seed oils, no margarine. Let's first of all look at the omega-3 index shown here in white. And what we can see is that over 12 weeks, the omega-3 fat EPA in our red blood cells increased by 21%. And if we have a look at the omega-6 levels in red, we can see there's a corresponding reduction of about 26%. All in all, that's not too bad, but it's not amazing either. Let's see what happened when we increased the omega-3 intake. Now we see a massive increase of omega-3 of 271%, and nearly double the reduction in omega-6 of 50%. And remember, these changes occurred with diet alone. No supplements were used. So the combination of both reducing omega-6 and increasing omega-3 is very effective, and almost certainly will help to protect from some of the damage caused by ultraviolet B radiation. So let's recap what we've covered today. Firstly, the UVA radiation from sunshine releases nitric oxide, which seems to be associated with a mortality benefit. It's mainly ultraviolet B radiation that causes sunburn and most of the skin cancer risk. And we can reduce our exposure to UVB while still getting enough UVA by exposing ourselves to the sun when it's lower in the sky, perhaps by using our shadow as a proxy. And of course, if we're concerned that we're not getting enough vitamin D due to the reduced UVB exposure, we can always supplement. And if you're diabetic, you can probably reduce your risk of skin cancer by taking metformin. And if you have a history of skin cancer, taking nicotinamide seems to reduce the risk as well. And getting the right balance between omega-6 fats and omega-3 fats seems to be incredibly beneficial, reducing our risk of melanoma and also increasing our resistance to sunburn. So in closing, appropriate sunshine exposure is actually good for our health, and militantly avoiding it probably causes more harm than good. And if we do want to expose ourselves to the sun, then there's ways and means, things that we can do to make it safer. Thank you.